Beautiful afternoon. Many thanks for joining me on the program Healthy Living with yours sincerely, Oluije Oihokai. We're here again talking about medicine, talking about how we can take good care of our health. Remember, health is wealth. Now, today on Healthy Living, we will be looking at drug abuse. Now, so many persons know the one we call codeine, cocaine, and some other things, yes. But today we're not just going to center our mind just on the hard substance. No. Today we're going to be looking at the medical aspects of drug abuse. And to do that with us today is a person of Mr. Ephraim Ibadin. He is a medical laboratory scientist specialized in medical microbiology in UBTH. Mr. Ephraim, good afternoon. And we also have the person of Mr. Patrick Igbinaduwa, Professor of Pharmacy, University of Benin City. Good afternoon, Mr. Patrick.
Good
or
afternoon.
Professor Patrick.
Okay, whichever one. Good afternoon.
Okay, so today we want to talk about drug abuse. Now, Prof, I would like to ask you, when we talk about drug abuse, now what does it entail? What is a drug as it is?
Okay, now a drug by definition is any substance, most often chemical substance, that alters the physiology or the body function of an individual. So anything that causes a change in the normal well-being or in your physiological makeup can be classified as a drug. By that definition, even the water you take, the food you eat, they become drugs because they all have effect on your physiology. When God made man, he made you to be whole. He made you to be complete. He made it such that everything about you is perfect and balanced. At that state, we call it the physiological state. In which state you mean, at that state, everything is balanced. So there are things you take that can teach that physiology that God created at creation to either up, down, side, affect your brain, affect your leg. So any substance that you take that alters that normal physiological state, we can classify it as a drugs. Now, by classical definition, when you for the pharmacists, you see there are about 7 schedules of drugs. And now the basic definition, what makes you to classify them into different groups is their ability to affect your brain or your emotions. We call it psychological, the tendency for psychological dependence or natural physical dependence. Now, so you have about classically 7 classes of drugs. Now, there are those ones that are never used for medicine. They don't have any usefulness. There are drugs, they don't have any use. There is nothing. They have not been used for anything. Something like nitrogen mustard, probably like all those gases. So they are never used for drugs. So they are placed under, we call them Schedule 1 drugs. Then there are those that, yes, they can be used for drugs, but when you use them for drugs, their dependence is very strong, such that their effect on the human brain or the psychology of the physiology of the human being is so strong. So medical practitioners always restrict such drugs. If you must use them, you must use them with utmost care, because any little distortion can cause a lot more harm to the body. And then down to about class 4, 5, where you have prescription drugs, where you talk about antibiotics. Now down to Schedule 7, things like Panadol, those ones that dependence is not very strong. Okay. You are sure that
you know what,
dangerous harm.
Prof, we will do well not to make mention of some drugs here as we are talking. You understand? Okay. So you can do well to just say there are some medications.
Some medication like NSAIDs, okay, that their level of dependence if you take them, the harm associated with them can easily be corrected. Not that there is none that doesn't have harm, but you can easily overcome them as compared to those in Schedule 1 and 2. So those Schedule 7, any person can just go out, over, get it in anywhere from any shop. So drugs actually, all drugs are not actually the same. It depends on their effect on our brain, on the level of dependence they can cause.
Okay.
Definitely.
Okay, now you talked about, you said there are 7
classes of drugs.
7 classes of drugs. Now when we talk about the classes of drugs, can we say, giving these to patients, is it just because they made mention of some certain ailments, you can't be able to prescribe it, or to some, they have seen someone undergo through the same condition and they feel, okay, this is what the person took, so I can also take it? Can that happen without the prescription of a pharmacist?
Okay. When I was talking, I said there are different kinds or classes by definition of drugs. Now, there are some drugs that can never be used, that are never used as drugs. You don't try it. There are some, if you are going to use them as drugs, it has to be under strict medical conditions.
Okay.
There are some, even the World Health Organization does not even allow you to use them as drugs, even though they can be used, but they don't even allow you to use them. There are some they have allowed you under restrictions, supervision of someone who has been trained medically. Then you must understand that we are all unique. We are different. The way your body is going to metabolize or utilize a drug is going to be different from the way my own body is going to utilize a drug. As a result of differences, when we speak generally as scientists, we look at what is the average common to every one of us. This is what we are expecting. But actually, we are all unique. We are individual differences, variations among us.
Okay,
so for each person to take any drug, you must actually be examined by the healthcare practitioner to say, okay, this is actually what you need.
This is what can work for you.
Yes.
So are we saying a drug that can work for Mr. A cannot work for Mr. B,
yes,
even if they have the same ailments?
Yes, it's possible.
Okay.
It as a result of where he has been to, as a result of exposure. He might have been exposed to some things. Okay, he might have been exposed to some things before now.
Okay.
So that again, in our body is made up of basically enzymes that that works on. We will talk about enzymes and receptors. It's just like lock and key. It's just like the door to your house. So if you are going to open a door, it's not though all door look alike, but the key that opens the door are not always the same. So even your own body, the way you will react to a drug is going to be different from the way I am going to react to a drug. Okay. Even you that is a woman, the way you are going to react to some particular drugs is different from the way I am going to react to some particular drugs. That's why in modern therapy, we talk about individualized treatment, drug monitoring. You have to be monitored. If you are taking this, at what is at social time, what's the quantity of the drug that is remaining in your body? What's the quantity we need to add? Because for every one you are adding, it's going to create an effect for you. So
in all this now, we would like to ask, what is drug abuse?
Okay. Drug abuse is when you take a drug that now have psychological, emotional involvement on your health, then you can say this is drug abuse. You are taking a drug and this drug is now beginning to affect your normal well-being. It's now causing trouble for your life. It's now you are supposed, a drug is supposed to help you. Or let me use it. But this again, you need to also differentiate this from drug misuse. somebody can abuse a drug,
True.
somebody can misuse a drug.
And also know the consequences.
The consequence, they all have consequences. So you can abuse a drug. But most of the time when we talk about drug abuse, most times we're talking about hard drugs.
Yeah.
Like all the, you say hard drugs, all these narcotics, morphines,
Cocaine,
that have,
all that.
those, like I told you, those are drugs that have been, because of their strong level of psychiatric or psychological effect, their ability to affect our senses is so strong. So you don't want to use such things, and everyone is advised not to go there. But there are also drugs that we know we can use, but we also need to use them well so that they don't create problem for us.
Yeah. Okay, now before I will go to your own aspect of asking, because we know in our society, lots of persons engage in self-medication. Now, we want to ask, why do self-medication exist in our society?
Well, many factors are responsible for self-medication.
Okay.
One is the relative ease with which drugs are available in our country.
Yeah.
You can get anything from anywhere. So because it's always available, so there's a lot of adverts, even concerning, people talk about it, even those that are qualified, those that are not qualified. So what you always hear about, you gradually begin to believe. So you always see it is available, you can easily get it. So that's one of the factors that is responsible.
Okay, I think you paused there with one of the factors, even as you're going to bring out the other factors that results to self-medication. Now I want to go to Mr. Ephraim, who is eager to actually let people know what he has in his mind. Now when we talk about the scientific aspect of drug abuse, now what are the administrative values of this drug abuse as far as the scientific part is concerned?
Well, you know, I'd like to restrict myself to the area of antibiotic abuse, because that really is where we dwell on more very well in the laboratory, medical microbiology laboratory. So antibiotic abuse is something that is rampant in our society, and of course it has effects on patients. In the laboratory, the rules we play is to try and isolate organisms that cause infections. You know, we hear a lot of infections like typhoid fever, urinary tract infection, and the likes. So the role we play is to isolate the organism and to try and see the exact antibiotic that will work against such organism. Now, the role of
laboratory testing.
Yeah, where antibiotic abuse and misuse comes in is if you not take the antibiotic up to the recommended dosage, or if you abuse that drug, take it above the recommended dosage, you may end up training those organisms, which may be flora in your body, to become resistant. And when those organisms are implicated in any other infection, for example, typhoid, I mentioned typhoid fever earlier, those antibiotics will not work. And so that's where we come in. Antibiotic misuse is a very burning issue right now, and WHO has recognized it. And we face this even in the laboratory, in the hospitals, both from patients admitted and community infections.
Okay, now talking about antibiotics, now what are the resistance to antibiotics testing in laboratory scientists?
Well, just like I mentioned earlier, patients come down with various kinds of infections. And so what is recommended by WHO, CDC, and all World Health Regulatory bodies is that when a patient has an infection, the right thing for the clinician to do, who is the first point of call, is to collect the sample from the patient, depending on the clinical site where the infection is. And so when that sample is collected appropriately, it is sent to the laboratory. It's advised that before you begin what we call empiric therapy, I'm sure Prof knows a lot about it, we mentioned something about it, that means begin treatment based on experience. You collect that sample and send to us, send to the laboratory, where we play key roles in trying to look at the causative agent, the organism causing that infection. And when we isolate it, that organism, we test it against a panel of antibiotics, because as you come to find out, it's not every antibiotic that works for every infection. No drug is a wonder drug per se. If you cast our mind back to the 1940s when the very first antibiotic came out, it's called penicillin. It worked on every infection, every bacterial infection, but today that drug does not work for any, or would hardly work on any infection.
Okay.
And so the role we play here is to try and get the organism that is causing the infection and to test it against a panel of various antibiotics that we have that are commonly available.
So are we saying as a scientist, now Prof, I'll come to you on the same question. Now, are we saying as a scientist, research over time has proven that, okay, this drug works for a particular purpose?
Well, the answer to that is a bit broad, because there are certain drugs that work in that are advisable for certain anatomical sites.
Okay.
No drug, it's not every drug that you just treat for every kind of infection. But beyond that also, the key word is that you isolate the organism and test it against a panel of antibiotics, because not every antibiotic may work against every infection, and that's because of antibiotic abuse and misuse, which is the key thing here. Antibiotic abuse and misuse has led to resistance in various organisms that can cause infection. And so over time, one may be infected with an organism, but even the drugs that are available in the pharmacy just may not work. And so that's the key role we play in trying to isolate the organism, test it against this commonly available antibiotic, and send our report to the doctor, who will now look at the various options he has and will administer the required antibiotic.
Okay. All right. So, Prof, you have something to say in line with what our scientists have just said.
Okay. I think the first question you asked ourselves is, why is it that a drug which worked yesterday refused to work today?
That was the reason why I asked him. Is it that over time, researches that has been done has proven that, okay, this drug has no effect on this person or this ailment?
The reason is this. Every organism, everybody wants to be alive. You see, these organisms you are talking about, bacteria, they are living things, they are living organisms. And so when you produce a chemical, a drug, to kill this organism, the law of adaptation means that this organism wants to also live. It tries to survive.
Okay.
So it develops mechanism within itself. How can I survive? How can I live? Sometimes it gets to a point, it develops a mechanism, is able to pump out your drug out of its system. So because you have exposed, most of the time, because you expose these organisms to suboptimal dose, it's just like what we're doing with vaccines. The same thing. What are we doing? We inject somebody with a lower dose so that your body begins to prime itself. So the next time it sees that same organism coming, this man is able to kill me. So let me quickly, it develop enough resistance against. The same thing this organism does. So the moment you probably senses the drug comes, so it says, oh, this was a drug that killed my ancestors yesterday. I'm not going to allow you to kill me. So what do I need to do to stay alive? Develop some, like the plasmid theory, develop a pump. So every organism wants to stay alive. So as human beings are developing technologies to kill the microorganism, to kill the virus, the viruses are also looking for ways to make sure that they survive, they stay alive. That is why we must look for the best way to killing these organisms so that they don't evolve new methods of staying alive.
Okay, now you talked about the organisms developing certain things to make sure they stay alive. Everyone wants to survive. Now you find some person saying, oh, I have malaria. I took this kind of drug, this time I had malaria. Okay, the next one, I don't want to take the same drug, so it can work well. So I want to ask, why do people have that notion that if they took a certain kind of malaria drug, this particular period they were sick, for the next one, they shouldn't take it? What gives them that notion?
Well, I think it's just psychology. Because one, ideally you are supposed to go for tests. Before you take, especially for antibiotics, there's the lab scientist is here. You are supposed to go for and look for sensitivity tests. The sensitivity test will tell you which is the organism that is best for the which of the drug that will be best for this particular organism that is causing this infection. Many a times what we call malaria in our environment might not actually be malaria, might even be missed infections. And that's why sometimes you finish treating with the anti-malaria, you see that the person is still persisting because sometimes there are misinfections that are associated with the malaria. So if you really just took the anti-malaria drug without treating the other infections, so if you have gone for, what happens when you kill only the malaria parasite, what happens to the other organisms underneath? They begin to do what? They grow better. They now have more. Imagine there were 5 organisms causing this infection. You kill 3, leaving only 2. What happened? The other 2, they now have more food. They now have more space to grow, and they become more virulent. They become, so when you now, the next time you are coming to attack with the same drug you used in treating it the last time, you see that it's not going to work because you have created an environment for super infections. And this is how this resistance of drugs develop, especially when we take substandard or inadequate medications. So it's always best, before you commence any treatment, do the right thing. And that is, go for a laboratory test. Let it be tested. Know what you are treating. Is this a missed infection? Is it actually a parasitic infection? Is it a bacterial infection? Is it a viral infection? You need to know what you are treating. Medical treatment is knowledge driven. It's not just something you just go by the roadside and see whatever you take. No, there is a systematic approach to treating infections.
Okay. Now, as a scientist, is it important that you have headache, you go for tests? You have flu, you go for tests? Is it important to always go for tests as a scientist?
Well, the basic thing is, if anybody is having symptoms of any ailment or feeling headache, running stool, diarrhea, whatever symptoms there are, first thing to do is to go and see a doctor. The doctor will examine you, and based on his examinations, if he thinks it's necessary to administer antibiotic or perform some tests, he will recommend the exact tests. And when those tests are carried out, of course, the results will be sent to the doctor appropriately, who will use his discretion based on the results. Okay,
so are you saying, as a scientist now, I cannot just come and walk up to you and say, oh, I have headache and I need you to run a test for me without having the prescription of a doctor?
Well, it happens. I may tell you, I'm what I believe is the ideal, but of course we know what you said also happens. We have patients who walk up to the laboratory, especially private laboratories, I'm having so and so symptoms, and with the knowledge they have, they collect samples and do the requisite test. But the ideal thing is you see a clinician who will examine you based on his experience in the university and experience in the university and on hand and on the job. And based on that experience, he will recommend certain tests, go to the laboratory, and those tests, based on that recommendation, would collect the required samples, and the report will be sent to the clinician.
Okay. Now, Prof, when does over-the-counter drug becomes drug abuse? And before you answer that, I know some persons, they don't know what over-the-counter means, over-the-counter drug means. I don't know why you're smiling. Okay, now, we want to know, what does over-the-counter drug means?
Okay, when I was talking about classification of drugs, I told you that there are some drugs that are so strong, when I use the word strong, in terms of their effect on our mental health, or the psychotropic aspect of them, effect of dependence, tolerance on us. So they are so strong that you reserve them. There are some that are allowed medically, under supervision. There are some drugs which, over time, due to the way they are being used, their effects have been monitored, that these ones have very mild effect on the human body. That if probably mistakes are made, the damage to the human body is not so as bad. So the WHO, or World Health Organization, allows some particular drugs in that class to be sold over the counter. In other words, you really don't need a prescription to be able to purchase those drugs.
No,
so it's allowed.
We know that some of us, we just go to a pharmacist shop and say, okay, I have malaria, and the pharmacist says, okay, this is what you should get, or this is what you should buy, or some other person just go, okay, please, I need so and so medication. When does this medication become drug abuse?
Okay, now it becomes drug abuse when, see, self-medication, where is the natural thing for every human being when you are sick, is I want to help myself.
Yes, or
okay,
I actually know what's wrong with me.
For example, no, I need to wear thick clothing. You're already trying to protect yourself. Yes. You don't need a medical doctor to tell you cover your clothes. You don't need a medical doctor, or if your environment is dirty and breeding mosquitoes, making you to be sick, you should be able to look around. Why am I sick? Evaluate yourself. Why am I sick? What is causing this illness? What can I do to make sure that I don't fall sick frequent? These are helping yourself. Public health things. Keep yourself clean, make yourself okay, keep yourself warm, avoid some places you are not supposed to go to. So those are some of the things that you can do for yourself. There are some things you can do for yourself, which is within acceptable norm. But there are some things you have not been trained to do for yourself. When you now begin to do those things, you have not been trained or you are not equipped for, either for yourself or for others, then you are already crossing the line.
Okay.
Yeah.
So that's what we can term as drug abuse.
You are abusing the drugs,
okay.
Yes.
Now when we talk about people that cannot actually do without the hard drugs, what can we say causes this things?
Many factors. Peer pressure is number one thing. Okay. I wrote down peer pressure. You see your neighbor using a particular drug, whatever name it is, and you just want to emulate him. Your television, the media, the internet. A child asked a mother a question, and the mother tried to paint it. And the next day, the child came to the mother and said, "Mommy, you didn't tell me the truth. I went to YouTube and I watched it, and I have the answer." In fact, the question was, she asked the mother, was, how is a baby formed? And the mother tried to paint it in a way. And the child came to the mother following the, "Mommy, you didn't tell me the truth. I went to YouTube and I watched YouTube." So there are some of these children, no child just start using drugs. It is what they see from their friends, from their homes, from their environment. The artists they mimic, they want to, they have a role model who they see as a role model, an artist, and they say, "Oh, this man uses drugs. Okay, why can't I also use it?" Again, another factor is our society is a society, I call it the society of pain. Almost person is hurt in one way or the other. And when you are filled with pains, you are tired. So people rely on some of these things to overcome some of their frustrations, some of the frustrations that they are faced with in life. And when you are encountered with such things, you see that they want to resort at something like a solution to run away. No, trying to dodge the reality. But the reality is
it's staring at them.
Is there. When the effect of those drugs come back. Again, another factor, relative ease of adverts. Many a times we see drugs that ought not to be advertised are advertised, and people say, "So you made this drug, can do this?" Say, "Okay, let me try it." Curiosity of the human mind. Let me just try it. Maybe if I use it, it might work, and a person uses it, it might actually work. But he or she might not know the danger, the problem that he has created for the future generation.
Okay. All right, in case you just joined us, this is Healthy Living with yours sincerely, Oluije Oyehokai, and we're looking at drug abuse, yes, in our society today. And I have Mr. Ephraim with us, and of course Professor Patrick is certainly educating us on all we need to know about drug abuse. Now, Prof, I would like to ask, what age do we find these things common as far as drug abuse is concerned?
Well, depending on the class of drugs, we tell you the kind of age. For example, the adolescents are known to be more prevalent to use of many of these drugs, either for experiment, curiosity, peer pressure. So they are more likely involved with this experimentation.
Now, when we make misused drugs, do they have effects in psychological well-being?
Yes, they do. Like I told you, psychology, mental well-being, psychiatric well-being, mental well-being. Your brain is supposed to be protected away from many of these drugs. But these drugs, when they have effects, depending on the kind of drugs that you are taking. For example, one of the most common drugs that people take is alcohol, and alcohol is a known depressant. So it makes you, the overall effect is that it reduces the activities of your brain cells. Whereas there are also other drugs that also increases the activities of your brain cells. There are also some other drugs that cause hallucinations, like marijuana, make you to start dreaming as if you're in another drug, or another world entirely. There are also some drugs just to relieve pains, like morphine and some other. So you just take it. Imagine somebody who has been in pain, and you just, with the moment you give them those drugs. So all these drugs can easily be abused. All of them can easily be abused.
Okay. Can any drug actually bring or spring up ailments in one's body? In terms of, you're not supposed to take this and you take it, and you find yourself, instead of treating a particular ailment, you're finding yourself getting sick with some other ailments you don't even know anything about. Can drug abuse resort to these things?
That's exactly what we've been saying. That drug abuse can lead to mental and physical illness. For example, the simple alcohol that many persons take can lead to liver cirrhosis. In other words, damage of the liver. And once you have damage of the liver, damage of the kidney, your liver can be damaged, your kidney can be damaged, and it can even lead to a cardiac problem, hypertension. You take a stimulant, and then it pumps your blood too much, and then it can lead to stroke, cardiac arrest. So that's what we are saying, that you must be very careful while using this drug. And that's the reason many of these drugs are not permitted in the first place.
Okay, now, as a scientist, can drug affect testing in the laboratory, in the lab? Can drug actually affect a test that has been done on a patient in the lab?
Yes. That's why the general principle before you begin a test, before you do a test, especially for when an infection is suspected, is that you collect the sample of that patient before you administer any antibiotic empirically. That when I say empirical, it means based on experience, not based on evidence, not based on laboratory evidence. That's because you may start with an antibiotic that may kill the organism, or that may inhibit the growth of the organism. And when you collect that sample and grow that sample in the laboratory to grow the organism will end up not growing, or may have issues that may not grow very well. And so to that extent, drugs, in this case antibiotic, taken before testing can affect the result of a test. So that's why the general principle by all health regulatory authorities is that before a test is conducted, before a test is conducted, no drug should be administered. That's the general principle.
So you have to go for the test before you take the medication that has been given to the patient.
Because commonly patients are always very eager for antibiotics or for drugs. So clinicians sometimes, when I say clinicians, doctors sometimes may just want to satisfy that patient, but the best thing to do is collect
Go
that
for
sample.
a test first.
Go for a test first. If the patient is so bad as to require empiric treatment, you may administer empirically, but collect that sample first.
Okay.
And so to that extent, drug may affect
Okay.
the results of a test.
All right. So before we go on a short break, there's this question I want to ask you, and I need you to, think towards it. Now, we find in our society also that some persons go down with malaria, and when they go down with malaria, they tend to take the malaria drug alongside the antibiotics. Now, when we come back after this short break, I would like to ask you, do they work in synergy? Okay, so that's a question we'll be posing before you. So let's go for a short break. We'll be right back on Healthy Living. All right, many thanks for joining us on Healthy Living with yours sincerely, Oluije Oyihokai. We have been talking about drug abuse in our society. And before the break, yes, I did ask our scientists in the house, why do people actually feel or think that there is a need taking malaria drugs and alongside accompanying it with antibiotics? Do they work in synergy? Is it a right practice?
At the heart of that, the answer to that question is being able to first of all identify what is causing the patient's problem.
Okay.
Because once you know the cause of a patient's problem, the problem is half solved.
Okay. No, I'm talking about the patient himself or herself.
I agree. I'm going
without the prescription of the doctor.
Okay, without prescription.
Yes.
We are still going somewhere.
Yes.
So it's always right that the patient, no matter what symptoms you are having, whether it's typical, whether you feel your tongue is bitter and so you feel it's malaria, try and go for a test.
Okay.
If the test confirms that it's malaria, if you go and see a doctor and he recommends a test and confirms malaria, then you treat malaria fair and square.
Okay.
Because the danger we have in treating, not just when you feel you have malaria, you take an anti-malaria drug and take an antibiotic alongside it, is that you are ending up training organisms on your body, because we have various organisms on our body as flora. We call them flora. They are normal. They help our body. They play key roles.
They now become diseased themselves.
You end up training them to become resistant to several other antibiotics, so that when any of those organisms are involved in any secondary infection, most drugs will not work against that infection. So at the heart of treatment of when a patient suspects he has an infection, be sure what the cause is by doing a test. As to whether two drugs can have synergistic effect, it's also possible. The patient is having malaria, test reveals having malaria and also UTI, or even say typhoid fever, which is
sorry, please, what's UTI?
Sorry, urinary tract infection.
Okay, because we want to know.
If by the doctor's differential diagnosis suspects patient is also having sign of urinary tract infection, the request for urine test, urine MCS test, urine microscopy, culture and sensitivity test in laboratory. You do that alongside the malaria test. Then you can go for an antibiotic. So and so to that extent, if the antibiotic you take, that's the antibacterial drug, and the anti-malaria drug can work synergistically to make the patient well. But most of the time, when the patient takes an antibiotic naively without any test, it's just abuse. Because the patient may just be having fever that is causing all those various symptoms that are making him feel he has, it's more than fever. There's something that's common in the environment. I get typhoid, I get fever, I get malaria. But the true prevalence of typhoid is actually low in our environment, in Benin City, for example. But you hear it everywhere, I get typhoid, I get malaria, I get malaria. It's very low. And so just a good anti-malaria treatment would eliminate whatever symptoms that patient will be having at that time. So at the heart of answering that question is, first of all, know what is causing the patient infection by doing the right test.
Okay. All right, so Prof, you're itching to say something. Okay, now back to you, Prof. We find some persons, they find it so difficult to sleep at night. Now they find themselves always taking a particular drug every now and then. Don't we think, or can we also say these persons are abusing these drugs?
Yes, like I said earlier, drug can be the types of drugs people abuse varies. Some abuse drugs just to make them sleep. We call those classes of drug tranquilizers, especially the benzodiazepines. They bring down the activities of the central nervous system. But these classes of drug also have another problem, which we call dependence or tolerance. What I mean by dependence is, for example, if 1 gram could cost sleep for you today, if you continue taking these drugs, by next 2 weeks, 1 gram will no longer be able to put you to sleep. You are going to need 5 gram.
Okay.
If you continue, you now raise the dose you are taking. Remember, the more the dose you are taking, you have only one liver that is metabolizing all the drugs that you are taking. So if your liver was metabolizing 1 gram before, now because the drug has now gone into that level of tolerance, is no longer working for you at that dose in which you were taking it, you now discover that you are going to take more. As you are taking more, the body system that is expected to metabolize to destroy these drugs in your body is going to work more. The enzymes are going to get saturated. And when these enzymes get saturated, they begin to produce dangerous metabolites that becomes dangerous to your body. Your body begins to overwork your heart, your liver, your kidney. And these are vital organs that you need to protect. So you overwork your body. So by the time, if you start taking those kind of drugs, maybe in your 40s, you are dependent on them, you can no longer sleep without them. You have raised your dose to a high level. What are you doing? You are building up series of problems for your future. And I don't think that is what every normal man will want to build. So by the time you get to your 70s, when you actually need these drugs to help you, you discover that there is none of those classes of drug that will even work for you again.
Okay.
And then you run into issues.
All right, so you can do well to call us on the numbers showing on your screen for you to ask any question you want to pose before our scientist and, of course, Prof in the house. Yes, we have talked about so many things as regards drug abuse in our society. So you do well to call us, and we'll be here for you to get to answer any question you want to pose before us today on healthy living. Now, we tend to find out that when we go to the hospital, I don't know, our doctors are fond of scribbling these drugs that they give to us. So we want to know, why don't they actually tell us, okay, this is the drug you're supposed to take? Is it as a result of, is it a preventive measure? Why do they do that?
You want to take it?
No, don't, go ahead.
All right, I know Prof was also itching to throw that on me, but most of the time it's to prevent the core theme of why we are gathered, the abuse.
Okay.
And so, but it's also the patient's right. The patient has the right to know what drug is being administered, and whatever drug.
Hello? Sorry, hold on. Hello? Good afternoon, what and where are you calling us from? Good afternoon, we can hear you loud and clear. Good afternoon. Khalifa, calling from Lagos. All right, go ahead.
My question is, from children that have worked, children that have worked before and they have stopped, all of a sudden these children cannot walk, they cannot talk, and then when you go to hospital, they'll say it's malaria. I have a child like that. After giving this child drugs, this child has walked before, today he can't walk, he can't talk. So then people are telling me the problem from the nervous system. Could that be true? Yes.
Okay, now, Prof.
Okay. Very unfortunate that you have that incident. But you see, malaria can present in many ways. There is even what we call cerebral malaria that can even be very dangerous. That's why the earlier you treat, the better. And that's why you should treat using the best medical care, best medical practice. You just said, oh, the child had malaria. What was the diagnosis? Who diagnosed that child as having malaria? Which kind of treatment did you give? Which drug was the child given? Does the drug have the ability to cause disability maybe in the process of looking for cure, like we have been saying, drugs that damage the nerves were applied on that child and caused more harm, which is even more permanent than they wanted to prevent. Normally, malaria cerebral malaria can be very, very dangerous. It can lead to paralysis. It can lead to many other things.
All right. Hello. Yeah, hello, good afternoon. What name are you calling us from? Okay, all right, so do well to call the number on your screen and we'll be here for you to answer any question you want us to answer. Now, back to our scientists. So why do these things happen when you find a doctor not wanting to tell the patient the particular prescription that is being handed over or the patient ought to take?
Well, it's a bit more of an ethical issue, but the doctor doesn't want was trying to guard against abuse, drug abuse.
Hello? Sorry, hold on, please. Hello, good afternoon.
Hello.
Yeah, I can hear you. Good afternoon. What's your name and where are you calling us from? Okay, I'm alright. We're calling from Ego. All right. Sorry, what did you say? Okay. Yeah, yeah. Okay, okay, you're asking if capsule and tablets work together. All right. Okay, now, Prof, I think you can answer to that.
Okay, okay. Well, again, unfortunately, people have different illness, different problem, and sometimes we have what we call polypharmacy. You are giving more than one or two drugs. Definitely, the drugs are expected to be synergistic. If the drugs you are giving is actually by a qualified medical personnel, the drugs are expected to be okay. Ulcer is a drug that ulcer is a disease, and there are drugs for treating ulcer. So you are expected to follow your doctor's prescription as indicated by your physician.
Okay.
He also mentioned the same, whether it's capsules or whether it's tablets.
Yes, if they work together.
Whichever one, they are all different dosage forms. Capsules is just putting the drug inside a plastic shell.
Yeah.
Just a plastic shell, you have a plastic shell, you put it, which easily dissolves. So it's not expected to interact. What is important is the active ingredient in the drugs. What is the active ingredient in the drugs that you are taking? It is, if those drugs interact, cause problem, they are what we call drug-drug interaction. One drug can have effect on another drug. A drug can even have effect on food. The food you are eating could also have effect on your drug. So many of all these things, that's why we always advocate, go to the right place. If you are sick, go to the hospital, see your clinician or your doctor, let him evaluate you, and then you know what next to do. Don't engage in your self-help, self-medication. That is where we have many of these problems. You say, I have BP. When last did you check your blood pressure? Are you still using the value given to your physician 5 years ago? There are some patients who have been on BP medication. Your BP changes with time. The fact that your doctor evaluated you and said your BP was this 2 weeks ago does not mean that the BP is still going to be the same. And the drug which you need, or the dose of the drug which you need, is going to change. So there is need for constant evaluation, and that's why we advise see your doctor regularly.
All right. Okay. All right. Prof has said it. Professor Patrick has said it. See your doctor, your physician regularly. Now back to Mr. Ephraim. Your last word, your words of advice to everyone watching and listening to you right now. What do you have to tell them as far as drug abuse is concerned in the scientific aspects?
Well, as much as we are humans in this world, we are bound to fall ill at various times. Now, if there's one thing we're going to take home is that before you administer any antibiotic, whether you suspect you have malarial infection, bacterial infection, viral, whatever it is, please go to the hospital, and for which you would do some laboratory tests. It's imperative you do those tests before you administer any antibiotic, so that you can have total care and good care.
All right. Okay, Prof.
Well, my advice is all drugs are poisons. So go with that notion that anytime you are taking any drug, I am actually taking a poison. So you need the best advice possible before taking it. So go to the right persons that can give you the right information, not just the roadside.
Okay, all right. Okay, thank you so much for being a part of us today on Healthy Living. Till I'll be seeing you again next week for another exciting time. Make sure you do well to go to the right places. Go to the hospital whenever you are ill or you feel any symptom at all. All right, to have yourself a blessed day. Remember, health is wealth. Bye for now.